Let's look at the people, another group right now, people who actually right now are buying their own health insurance under the current plans. It's about 15 million Americans that are doing that. What will this mean for them, and what do they need to do?
Well, the thing you have to also understand is the people who shop for coverage today in that market, who shop for themselves, it's not just the 15 million people who buy insurance. It's the 50 million who don't buy insurance because it's too expensive for them. So it's really a 65 million people who are affected by the changes in the individual market for health insurance.
All right, let's talk about those 65 million. Your article, an article you just wrote, says that as opposed to what the government said earlier this week, where they had found that rates were going to be lower than expected, you find that their rates are going to go up dramatically.
Well, we don't disagree about the numbers. It's just we're talking about different numbers. So they're saying lower than expected, meaning what the CBO projected in 2010 for what rates would be in 2016. But of course, for the average American, what matters is how much does it cost me to buy insurance today in 2013, and how much will it cost me to buy insurance in 24 under Obamacare? And what the Manhattan Institute study showed that I was involved in was that for the average person who's a male, it'll be up by 99%, the underlying cost of premiums, that is pre-subsidies. And for women, it'll be up about 60%, 62%.
Wendell, do you have any argument with that?
Well, I'll tell you what, the individual market is just 15 million, actually not quite even that, because of the practices of the insurance industry that is going to be changed considerably, and many of the practices outlawed. And that is the thing that this study obscures quite a bit, is a lot of Americans who don't have coverage are not only because it's too expensive, but in many cases they can't buy it at any price. They've been refused coverage. They've been declared uninsurable. That's why we have so many people who don't have insurance. They will be able to get coverage through this marketplace.
Yeah, so I have to disagree with that, because it's actually a very, very small fraction of the uninsured population who can't get coverage, who are denied coverage because of a pre-existing condition. It's between 1% and 5%. The vast majority can't afford insurance because it's too expensive. It has nothing to do with their health status.
I don't disagree with that, but a lot of people cannot get it because it has been the practice of insurance industries, including the ones that I work for, to blackball you if you've had pre-existing conditions. And yes, many people can't get it at any price or can't buy it because the premiums have been so high. That's why those two reasons are why the individual market is so small.